Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In this video, we will cover other important topics of evolution and management service, including nursing facility and home or residence service, along with the guidelines and practice questions to easily grasp the concept. So, without further delay, let's get started. The code range 99,304 to 99,316 are used to report the evaluation and management services to patients in nursing facility and skilled nursing facility. These codes should also be used to report the evaluation and management services provided to a patient in the psychiatrist residential treatment center and intermediate care facility for individuals with intellectual disabilities. Nursing facility services are performed by the principal physician and other qualified healthcare professional overseeing the care of the patient in the facility. These services are also performed by the physician or the qualified healthcare professional in the role of specialist performing the consultation or concurrent care. Two major subcategories of nursing facility services are recognized as initial nursing facility care and subsequent nursing facility care. Both categories apply to new or established patients. The type of care, like skilled nursing facility and nursing facility care, are reported with the same code. Place of service codes should be reported to specify the type of the facility and care where the service is performed. When selecting a level of medical decision making for nursing facility services, the number and complexity of problems addressed at the encounter is considered. A high-level MDM specific to initial nursing facility care by the principal physician or the qualified healthcare professional is recognized when multiple morbidities requiring intensive management, a set of conditions, syndrome, or functional impairment that are likely to require the frequent medication changes, treatment changes, and or re-evaluation. The patient is at significant risk of worsening medical status and risk for the readmission to the hospital. The code range 99,304 to 99,306 is used to report the initial nursing facility care. Code selection is based on either MDM or time. Code 99,304 is used for initial nursing facility care per day for the evaluation and management of a patient, which requires a medically appropriate history and or examination and straightforward or low level of medical decision making. Code 99,305 is for the moderate level of medical decision making, and Code 99,306 requires a medically appropriate history and or examination and high level of medical decision making. When using total time on the date of encounter for code selection, code 99,304 requires a minimum of 25 minutes. The time range applicable to code 99,304 is 25 to 34 minutes. For code 99,305, the time range is 35 to 49 minutes. And for code 99,306, it is for 50 to 64 minutes. For services of 65 minutes or longer, use prolonged service code 99,418. When the patient is admitted to the nursing facility in the course of an encounter in another side of the service, like hospital emergency department or office, the services in the initial site may be separately reported. Modifier 25 may be added to the other evolution and management service to indicate a significant separately identifiable service by the same physician or the qualified healthcare professional was performed on the same date. Hospital inpatient or observation discharge services performed on the same date of nursing facility admission or readmission may be reported separately. Time related to hospital inpatient or observation care services may not be used for course selection of any nursing facility service. Initial nursing facility care course 99,304 to 99,306 may be used once per admission per physician or the qualified healthcare professional regardless of the length of the stay. This may be used for the initial comprehensive visit performed by the principal physician or the qualified healthcare professional. Skilled nursing facility initial comprehensive visit must be performed by the physician. An initial service can be reported when the patient has not received any face to face professional service from the physician or the qualified healthcare professional or another physician or the qualified healthcare professional of the exact same specialty and subspecialty who belong to the same group practice during the stay. It can be used if the patient is a new as defined in the evolution and management guidelines. Initial services by other physician or the qualified healthcare professional who are performing consultation may be reported using the initial nursing facility care or inpatient or observation consultation codes. The code range 99307 to 99310 is used to report subsequent nursing facility care. Code selection is based on either MDM or time. Code 99307 is used for the subsequent nursing facility care per day for the evaluation and management of a patient which require a medically appropriate history and or examination and straightforward medical decision making. Code 99308 is for the low level of medical decision making. Code 99309 is for moderate level of medical decision making. And Code 99310 requires a medically appropriate history and or examination and high level of medical decision making. When using total time on the date of encounter for code selection, code 99307 requires a minimum of 10 minutes. The time range applicable to code 99307 is 10 to 19 minutes. For code 99308, the time range is 20 to 29 minutes. For code 99309, the time range is 30 to 44 minutes. And for the code 99310, it is for 45 to 59 minutes. For services of 60 minutes or longer, use prolonged service code 99418. Subsequent nursing facility care services may be used in the following cases: when separate sites are reported and the initial nursing facility service is a consultation performed by the same physician or the qualified healthcare professional and reported on the same date. In this case, the consultant reports the subsequent nursing facility care course for the second service on the same date, or when the medically necessary assessments are conducted prior to the initial comprehensive visit. In cases of transition between the skilled nursing facility level of care and nursing facility level of care, these does not constitute a new stay. The codes 99315 and 99316 are used to report nursing facility discharge services. Code 99315 is for the nursing facility discharge management of 30 minutes or less total time on the date of the encounter. Code 99316 is for more than 30 minutes total time on the date of the encounter. The nursing facility discharge management codes are to be used to report the total duration of the time spent by the physician or the qualified healthcare professional for the final nursing facility discharge of a patient. Nursing facility discharge services include final examination of the patient, discussion of the nursing facility stay, even if the time spent on day is not continuous. Instructions are given for continuing care to all relevant caregivers and preparation of discharge record, prescriptions, and referral forms. These services require a face to face encounter with the patient and or family or caregiver. Date may be performed on the date prior to the date the patient leaves the facility. Course selection is based on the time spent on the discharge management face to face encounter, regardless of whether it is continuous or not. The code range 99341 to 99345 is used to report home or residence service for a new patient. Code selection is based on MDNR time. Code 99341 is for the home or residence visit for the evaluation and management of new patient with straightforward medical decision making. Code 99342 for a low level of medical decision making. Code 99344 is for the moderate level of medical decision making, and code 99445 requires a medically appropriate history or examination and high level of medical decision making. When using total time on the date of encounter for code selection, code 99341 requires a minimum of 15 minutes. The time range applicable to code 99341 is 15 to 29 minutes. For code 99342, the time range is 30 to 59 minutes. For code 99344, the time range is 60 to 74 minutes. And for code 99345 is for 75 to 89 minutes. For services of 90 minutes or longer, use prolonged service code 99470. The code range 99,347 to 99,350 is used to report the home or residence service for an established patient. Code selection is based on the MDR time. Code 99,347 is for the evaluation and management of an established patient with straightforward medical decision making. Code 99,348 is for the low level of medical decision making. Code 99,349 is for the moderate level of medical decision making, and code 99350 requires a medically appropriate history and examination and high level of medical decision making. When using total time on the date of encounter for code selection, code 99347 requires a minimum of 20 minutes. The time range applicable to code 99347 is 20 to 29 minutes. For code 99348, the time range is 30 to 39 minutes. For code 99348, the time range is 40 to 59 minutes. And for code 99350 is for 60 to 74 minutes. For services of 75 minutes or longer, use prolonged service code 99470. Home or residence services are used to report evolution and management services provided in a home or residence. Home may be defined as a private residence, temporary lodging, or short term accommodation like hotel, campground, hostel, or cruise ship. These codes are also used when the residence is an assisted living facility, group home, custodial care facility, or residential substance abuse treatment facility. For services in an intermediate care facility for individuals with intellectual disabilities and services provided in psychiatric residential treatment center refer to nursing facility services. When selecting a code level using time, do not count any travel time. To report services when a patient is admitted to the hospital in patient observation status or to the nursing facility in the course of an encounter in another setting, use initial hospital inpatient or observation care or initial nursing facility care codes. What category of codes should be used to report an evaluation and management service provided to a patient in a psychiatric residential treatment center? Option A with the home or residence services code, option B with the advanced care planning codes, option C with psychiatric collaborative care management service code, option D with the nursing facility service. This is an important and frequently repeated question in the exam. Always remember, for psychiatric residential treatment center, nursing facility service codes are used to report the evolution and management service for the patient. Dr. Drake discharges Mr. Stephen from the hospital with early onset dementia, stage 4. He spent 45 minutes at the bedside explaining the medication to Mr. Stephen and his wife. On the same date, Mr. Stephen arrives at the Sunnybrook nursing facility and Dr. Drake carries out a medically appropriate assessment, spending a total of 25 minutes admitting the patient in the nursing facility. What CPT code is reported? Option A with the code 99,238 and 99,305. Option B with the code 99,239. Option C with the code 99,238. Option D with the code 99,239 and 99,304. In the given scenario, the patient is discharged and admitted to the nursing facility on the same day. To choose the correct option for the discharge and admission to the nursing facility on the same day, we follow the CPT guideline, according to which hospital inpatient or observation discharge services performed on the same date as nursing facility admission or readmission may be reported separately. The hospital or observation discharge services may be reported with code 99,238 or 99,239 as appropriate. Time related to hospital inpatient or observation care services may not be used for the code selection of any nursing facility service. Based on this guideline, we first eliminate option B and C as they only include code for the discharge services. Dr. Drake spends 45 minutes performing the discharge service. On the same day, Dr. Drake conducts a medically appropriate assessment, spending a total of 25 minutes admitting the patient to the nursing facility. Based on the time spent performing the discharge service and admitting the patient in the nursing facility, the correct option is option D with the code 99,239 and 99,304. Code 99,239 is for the hospital inpatient or observation discharge day management for more than 30 minutes on the date of the encounter. Code 99,304 is for the initial nursing facility care per day for the evolution and management of a patient using a time range on the date of the encounter of 25 to 34 minutes. A provider makes a home care visit to a 65-year-old hemiplegic patient who has been experiencing insomnia for the last 3 weeks. The patient has been homebound for the last year. The last visit from this provider was 4 months ago to manage his DM. The physician performs an expanded problem focused examination and low MDM. The provider speaks with the spouse about the possibility of placing the patient in the nursing facility. But CPT code is reported. Option A with the code 99,350, option B with the code 99,214, option C with the code 99,342, option D with the code 99,348. According to CPT Evolution and Management Guidelines, Home Services Code 99,341 to 99,353 are used to report evolution and management services provided in the private residence. We first eliminate option B with the code 99,214, which is used for office or other outpatient visit. Home or residence visit codes are generally divided based on whether the patient is new or established. In the given scenario, the patient is an established patient. Therefore, we will eliminate option B, which uses code 99,342 for the home or residence visit for the evolution and management of a new patient. Both codes in option A and option D are used for the home or residence visit for the evolution and management of an established patient. Code selection is based on either MDM or time. In the given scenario, the provider performed an expanded problem focused exam and low MDM result in the code 99,348. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.